Myself, I graduated from Tufts School of Dental Medicine in 2001, and have been licensed as a general practitioner since then. Prior to that, I was involved with collegiate sports. I was a soccer player in the late 80s, early 90s, and played professionally for about 4 years before I started to pursue my dental career. I love what I do, and I'm very active in my profession by trying to always learn new things, and I have a very solid mentorship program around me of excellent doctors, dentists, that I can always go to if I need some advice. And that has really allowed me to be very confident in the services that I can provide for patients. When a patient walks into the practice, they have a preconceived notion of what a dental office is. And you hear of all the horror stories of coming to the dentist, and and I hear it too. I hear the fact my patients say, "Oh no, not a root canal. Oh my God, that's really painful." Or any procedure that I'm going to perform, the first thing they ask is it going to hurt? And I take a lot of pride in making sure that the person that walks into the office understands that I understand that they're already a little bit uncomfortable walking into the practice. And I want to make sure that they get an experience that they've never felt before. And that starts from the initial phone call to the actual clinical side of dentistry, of getting the patient in the chair, make sure that they are comfortable in the chair with pain-free dentistry. And I think that in itself is kind of an eye-opening experience for them, where they realize that this isn't quite what I assumed or what I thought it was going to be like. I realize that this is a service industry. Sure, I'm a clinical dentist, and I think I'm very good at what I do, but I'm also providing a service for a consumer that's coming into the practice. We have to be different, and we have to provide a service that goes beyond what the consumer, or the patient in this case, is expecting. I love coming to my practice. I enjoy the patients that I have in my practice. I have some very good relationships with my patients in my practice. I have relationships outside of the office with some of my patients. We go play tennis, we golf, some of the guys I play soccer with. The vision of the practice for me is to maintain low volume, high quality, and really listen to the patients that are walking into the practice with their past dental experience concerns and their future goals of what they want to see and how they want to feel. We typically do not start treatment right at that examination appointment, because I want that patient to go home, have some time to think, and decide whether they want to make that investment financially, and also digest the appointment. Educating is important, but we also have to make them realize in certain cases that the final decision is theirs. The last thing I would want is to feel like I'm pushing somebody into doing something that they're not comfortable doing, and I don't think that's right. Starting out as a general dentist is a stepping stone. There is so much more out there that we're able to accomplish and do for patients today that, quite frankly, from doing cosmetic dentistry to changing somebody's life, from all of the, and I hear these stories in my office. When I was a child, I was teased. When I would go into social settings, I couldn't open my mouth. I'd hide away from pictures, family pictures, reunions. I don't go to parties. I don't go to social events. I stay home because I don't want people to look at me, because I'm embarrassed of the way my teeth look. I've heard all of that. To now, with sleep apnea, and these are medically documented literature, it's not something I've just created, it can kill someone. So, cosmetically we can change the look, and sleep apnea, is a serious medical condition. Now, I have a medical team that works with me to help the patient with sleep apnea. I'm not naive enough to think as a dentist, I'm going to treat this medical condition. The concept of being a general dentist is definitely a great stepping stone, but the beauty and I kind of go back again to my athletic background, because in sports, if you don't have passion, you will never succeed. If you're not passionate about your sport and love what you do, you will never want to advance. Crazy as it sounds, it's the same in dentistry in so many respects, because I love what I do so much that I know that there's so much to my profession that I don't know. If somebody comes to me and says, "Doc, I can't sleep at night because my jaw wakes me up," and I give them some logic behind why that happens, and it makes sense to them, isn't that wonderful? And as a general practitioner, I was missing that. I was missing that connection with my patient, because they would ask that question. And I'd have well, I don't know. The typical, here's a night guard, the typical, too much stress in your life, are the typical answers that doctors/dentists give to patients. And that's kind of, quite frankly, I don't want to use this term, but it's a little bit of a cop-out in not having the dentist fully understand why it is that you are having pain at night enough to where it wakes you up, or enough pain during the day that it doesn't allow you to function normally. The important thing for me is to make sure that I continue to educate myself, continue to be upfront, be fair, and to my patients, and make them comfortable enough to where they trust what they're getting when they come into our practice. Prevention is very important. It will, in the long run, financially save yourself individually and your family money. So come in every 6 months for your checkup, exam, and x-rays, and allow us to share with you what opportunities we have to catch the problems early and prevent extensive dental work in the future. The good news is we're able to do so many great things in dentistry today, from implant dentistry to working with our medical friends to treat sleep apnea, to being able to predictably help patients that suffer from TMJ for years. The potential of dentistry is great. The products in dentistry today are way beyond anything that was even available 8-10 years ago. It's just a very exciting time right now to be a dentist and to be able to share my knowledge with my patients.